In HealthWorks, how young is too young to have cosmetic surgery? More and more teens are getting nose jobs. Even the hit Fox show Glee touched on the subject recently. So if your teen is asking to have a procedure like this, how do you know if it's really necessary? Joining me this morning to help us figure it out with some answers this morning, Dr. Micheal Eisemann. So glad you're joining us to talk about this because we do see it on TV a lot and we're hearing more and more about it. What do you tell a teenager if they come in? Where do you even begin with them?
Well, basically, I ask them why they want the operation, what is it that bothers them. Typically, an individual who's young, an adolescent, their nose is too large. It's disproportionate with their face, and sometimes there's a lot of psychological discomfort that they may have, and basically this operation probably has the most dramatic effect on improving a person's appearance as well as improving their self-esteem and self-confidence. It's a difficult operation, probably the most difficult of the cosmetic operations, basically because the anatomy is so variable and there's no standard operation and the patient's expectations are very high.
What is the minimum age then, let's say? Do you have a minimum age or does it all depend on their maturity and really where they are in life?
Yeah, it definitely depends on their maturity, not only psychologically but also physically. Between 14 to 15 years of age for women, young girls, and 17 or 18 for men. And we usually wait till their nose is mature so it doesn't cause any growth arrest. Operating on the bone before that time could cause an arrest of growth.
Is this something that you really discuss with the parents as well to make sure that everything is in line with their personality and making sure that they're not going to get obsessed with plastic surgery?
Well, before they're able to sign their own consent, we see the patients with their family, and we usually do this with a video imager. In our office, we have a video imager which kind of morphs an individual's face and shows them what they might look like afterwards. But it's important to assure that the form that they have is real, not imagined, and also that there's not a preoccupation or an over-anxiety, with the deformity, which may indicate some underlying psychological problem. And you can tell this individuals basically, sometimes they become very introverted, they don't look at you when they talk, they don't smile, they don't have a personality or a sense of humor even.
And so you really have seen that this can help shape their self-image and make them feel stronger, because it seems like plastic surgery does get a bad rap sometimes, but you really feel like it could enhance their lives besides their looks, make them feel more comfortable in their skin.
Yeah, exactly. It's very important to create a body image, and basically we show pictures before and after of representative patients with a photo album. We have this on our website at Cosmetic Surgery Houston, and basically they can see numerous patients with before and after pictures to see what really happens, as well as what's done with a morphing image.
I think that is a neat thing that they can see, so they can really get a true idea of what they could look like and not, fake themselves into believing it would be something else. Now, it's the month of May, lots of graduations going on. Do you see an up of people really interested in having this procedure done? I
think this operation is a very old operation. It's nothing new, and as I was saying before, the most common time to do this operation is in adolescents, basically young adults, but it's been done for many years. It's very popular, and it probably has the most profound effect of any of the cosmetic operations that we do.
Do you see boys and girls coming in, or mostly young girls?
We see both, actually. What we do see sometimes, unfortunately, is parents bringing in children who don't want the operation. We had one recently who came in, and the mother was convinced that the child is a model, and brought her in, and the girl had no interest in having the operation.
So obviously you wouldn't do it in that case.
Obviously.
All right, Dr. Eisemann, thank you so much for your time today. We appreciate talking to you and helping us walk through this procedure that's becoming more and more popular, it seems like, every